Hello, my name is Dr. Lee Lindquist, and I am Chief of Geriatrics at Northwestern Medicine. Geriatric knowledge needs of primary care providers, the asked questions. So what we know is that everybody out there has questions about geriatrics. Geriatrics is something that we all want to learn more about, especially to take better care of our patients. And so I give a lot of talks throughout the country. Northwestern partners with Pri-Med to deliver geriatric content throughout the nation. Every time we give talks, we give 60-minute talks, and they're usually geriatric-based. All of mine are geriatric-focused. And there's also a QA session at the end. Everyone has been at a conference where there's somebody that comes up and asks questions at the end. And you know these people, you might be one of them, but we all have questions. So what we did is that we looked at all the questions that have been asked over the past 2 years at these conferences, these clinical-based conferences of primary care providers. And this is the asked question. We were at 12 different states, and there's probably around 1,000 to 2,000 providers that have been to any of these talks. Each talk sometimes gets 300 people, sometimes get 1,000 plus. And so the questions that we got from people, there was about 158 questions that people had asked over those years at these conferences. And the questions were, it shows you what the primary care provider is really interested in, what they have questions about. For instance, the questions that we did a mixed method analysis of it. We looked at the qualitative responses, and then we coded them. So the questions that people had were about deprescribing. How do I deprescribe meds for a person who's asymptomatic and is looking really good? Do I try? Should I do it? What about benzos? Should I try to deprescribe a benzodiazepine, which we all know is not the best for older adults? We had questions about weight loss. How do I help my older adults gain weight? What can I do to help them? Questions about sleeping. How do I get my older adults to sleep? What medicines are out there that can help them, or do I even need a medicine to help them get sleep? And so these were the main questions that we were getting asked, the primary different types of themes. What was concerning, too, among these questions is that there's several questions that came in, or more than a handful, where people were doing the wrong practices. Why can't I prescribe a benzodiazepine to an older adult to help them sleep, which we know is incorrect? Why can't I place a gastric tube in an older adult? Why can't I, give people, recommendations that we knew are not right? Prescribing an antibiotic, prescribing a medicine that we know is not considered a good quality care. And on top of that, we had a lot of questions about Alzheimer's. Is this drug good? Is this drug good? Is this drug good? And nutraceuticals. So what different vitamins are good for older adults? Should I be still using vitamin E, which is not recommended anymore? And so it was a very interesting study that we get to do, and it's interesting to look at people's questions. What we found, and what we actually thought about further down the road, is that we need to do more to disseminate. We need to do more to get people to understand and to feel like they can ask questions, either through telehealth, sending patients to Northwestern Medicine or Northwestern Geriatrics, or talking to our geriatricians here, asking questions. And it's important that we disseminate geriatrics as widely as we can, because there are primary care providers who may not have access to geriatrics and have questions. So thank you very much.